I can. And now I'm starting. We're go ahead and start.
Okay, and I can see the discussion. Can you?
I can now.
Okay, cool.
Yeah, so we're set. We just had to relog off. So
Sorry.
anyway, hi. I'm sorry, folks. This is a bad start, but hopefully this will be very entertaining or at least informative for you folks. My name's Johnny Adams. I'm the Chief of Police here at Santa Monica College. I've been here for about 4.5 years, and I have about 35 years of law enforcement experience, all in the academic setting. Worked at UCLA for 29 and a half and USC for about 2.5. So I'll go ahead and let Susan introduce herself.
Hi, everyone. So happy that so many of you could join us. My name's Susan Fila, Director of Health and Wellbeing. I'm a licensed clinical social worker, and I've worked at the college for about 4 years.
Okay, so I'll go ahead and share my screen so you can see our presentation, and then we're going to also have Q&A, but also talk about our roadmap to recovery and where we are as a college. So I've got my screen shared, and so Susan, I'll go ahead and...
All right. So we're going to be talking today about SMC and COVID-19 safety. So kind of so we can all start on the same field, we wanted to just kind of define what is COVID-19 and what is a coronavirus. So coronaviruses, for those of you who aren't familiar, are a really large family of viruses that are common in both people and in animals, believe it or not. And so they cause things like the common cold. Every year we get different kinds of colds going around. Some are worse than others, but there are hundreds and hundreds of coronaviruses around. But the difference between coronavirus and COVID-19 is that our body has built up some level of immunity to most coronaviruses, and COVID-19 is a brand new one, and our body has built absolutely no immunity toward this virus. And so it can really impact, our ability, primarily our respiratory system to breathe. So COVID-19 is, can you just go back? Sorry, I wanted to define one more thing. It's a respiratory disease that is being spread by a new coronavirus that emerged in 2019, and it impacts both our upper and our lower respiratory tracts. Okay, next slide. So we wanted to make this as interactive as possible. So I'm going to ask you all to use the chat, and I'm just going to ask you whether you think this is a myth or a fact. Okay. So question, the COVID-19 virus does not live on surfaces, so I don't need to worry about touching things outside my home. Do you think that's a myth or do you think that's a fact?
Do you want me to go to the next slide?
Yes, please. So it's actually a myth. The amount of time that the virus can live on surfaces depends on the type of material of that surface, right? So it depends on the surface. So for stainless steel, it can live for about 72 hours. On copper, it's going to be less than 4 hours. On cardboard, it's less than a day. So the best way for all of us to protect ourselves from surfaces, knowing that not all surfaces are disinfected, right, is to wash our hands frequently with hot soapy water. So what that means is like kind of as hot as you can stand it, but not like you don't want to burn yourself. And just sing happy birthday with like lots and lots of suds. So it's not a quick wash. It's not cool water. Obviously, if cool water is the only thing you have, that'll do, but it's better than hand sanitizer by far. All right, next slide.
Okay, so people who have COVID-19 always have some kind of symptoms. Myth or fact? Let's see. It's actually a myth. COVID-19 may be spread by people who are not showing symptoms. As a matter of fact, that is kind of the reason why we had to go back from the orders that the county had. We had many people, they were asymptomatic, that were out there spreading the virus, and we didn't really know enough about the virus at the time to understand the impact. And that's why we're still in the situation that we're in, but we're hoping to move forward very quickly.
Okay, and I see most people got that right. So myth or fact, only people over 65 or people with chronic health conditions can get really sick from COVID. Do you think that's a myth or do you think that's a fact? I see, yeah, someone says myth for sure. Myth, okay. Yeah, so you're right. It's a myth. People of all ages can get COVID-19 and are at risk of getting really, really sick. We've seen lots of people in intensive care units who are under 65. We can all really help by just wearing your cloth face covering when we're outside our home, or if we're around people that are not living with us on a regular day-to-day basis, as well as just kind of keeping that distance from each other. Next slide.
Okay, you can get COVID-19 from talking to someone up close for about 10 minutes. Myth or fact? It's actually a fact. Being in close contact within 6 feet puts you at risk for contracting COVID-19. Now, we talk about the 6-foot distancing rule as kind of the norm, but understand, even if you're outside, you have wind conditions. If the wind's blowing in your face and the person just coughed, that stuff is going to go towards you. The other thing is, if the ventilation in the building is not very good, sometimes it can remain in the air. There's a lot of studies out there that are talking about this. So, the best thing to do is always wear a face mask or a face covering when you're close by with somebody near you.
So what are the symptoms of COVID-19? Well, the reality is they totally range. They look different in different people. So you can experience symptoms anywhere between 2 days after exposure to someone who's positive up to 2 weeks later. So those symptoms can be things like cough, shortness of breath, just feeling really, really achy, having a headache. The Centers for Disease Control recently added losing a sense of taste or smell. That's a new symptom. Having a really sore throat, congestion or runny nose that's not related to allergies, nausea, vomiting, or diarrhea. And this little picture that you can see in there, you can see like what makes you at highest risk or lowest risk. So if someone has COVID-19 and they're not wearing a face covering, even if you're wearing a mask, you're still face covering, you're still at risk. But if the person who has COVID-19 is wearing a face covering and you're not, that's still lower, right? But the best way to protect ourselves is for everybody to wear cloth face coverings and keep our physical distance, because we never know who's going to, have COVID-19. Next slide. So what should you do if you have symptoms? If you have a fever or a cough or any symptoms at all that are not related to, let's say, an illness that you've had for a long time, like a chronic health condition or maybe allergies, you should definitely stay home. Staying home is the best thing you can do, and contact your healthcare provider. If you don't have a primary healthcare provider, call Shuttle Services. We will help connect you to one, and you can also be seen by a nurse or a nurse practitioner, either by phone or Zoom, whatever's most comfortable for you. You can email healthcenter@smc.edu. Our nurses are here 5 days a week to help you. And the most important thing to do is, even if you haven't had a COVID test and you just don't know, like you might have COVID, you're not sure, just stay home and isolate yourself as much as possible from anyone else you live with. So if there's a way that you could, stay in a separate room, and if you need to come out of the room to be around other people, wear a cloth face covering. We want to protect those that we love as well. And of course, if you want to get tested for COVID-19, we can help connect you with someone who can get you tested as well. Next slide, please. So we also just wanted to put a slide in here, recognizing like COVID-19 has impacted everybody in so many ways. You all are spending probably more time on the computer than you did before, and it can be really isolating for a lot of people. So we just think it's really important for you to take care of your emotional health. I'm going to put in the chat after I stop talking. We have confidential services just for you, Center for Wellness and Wellbeing. So I would encourage you, just if you're ever interested, you could do a checkup. It's cww@smc.edu. You can email the Center for Wellness and Wellbeing to connect with someone if you're struggling. Taking breaks from technology is really, really important, especially since we're on technology and we rely on it so much more now than ever. Also taking care of your body. So eating regular healthy meals, getting exercise, enough sleep, but, of course, avoiding drugs and alcohol. And if you struggle at all with getting kind of consistent healthy meals, we have a food drive every Wednesday at 12:30. All you have to do is just be a student. We have a walk-up area and a drive-through area. Just bring some sort of proof that you're a student. If you don't have a student ID, if you could pull up your classes online from your phone, that'd be great. And you get like a week's worth of groceries. So we want to make sure all of our students are healthy and nutritious this semester. Make sure to make time for self-care. So do things that you enjoy when you can, even if it's just like going outside for a short walk, or talking with a friend over the phone or via Zoom, just listening to music, journaling. There's lots of ways that we can just do things that we enjoy. Connecting with others is really, really important. And of course, connecting with your community. And if faith-based organizations is something that, is important for you for spirituality, make sure to do that. Next slide, please.
Okay, so now we're going to talk a little bit about SMC's Road to Recovery. We call it the R2R. We may go a little bit off of the slides in a few because recently the website was updated and now we've gone live with our plan. So I think it's really important if you have some time and you want to see what's going on, it's all there. One of the things that we wanted to look at when we were making this plan is we wanted to provide broad institutional and operational level guidance. So what does that mean? That means basically we wanted to make it as easy as possible so when they read this document, they knew exactly what to do in every situation. So we had to kind of think about every situation. And so we took a phased approach on how we come back. And so it kind of mirrors how the state has 4 phases of recovery. The county has 5. Well, we have 5 phases as well. And part of the success of our efforts is really we call it mindfulness and responsibility of all of our stakeholders. We say mindfulness is if you heard on the news, like USC had to go back to online only, and same with UCLA. Part of that was guided because the county told them that that's what they had to do. But I think it's really important that the county made their decision because of those outbreaks. And those outbreaks occurred because, people were not social distancing. They were in communal living situations where they weren't wearing masks and they basically spread the virus amongst each other. So some of our core principles, we want to ensure the health and safety and well-being of everybody, the faculty, staff, and students. That's what drives us on all of our decisions. We look at risk, and we also know that there's a good possibility that things could, surge, and we want to make sure that we don't have those issues or problems here at SMC. We want to continue to maintain our high academic excellence, and we want to look at equitable practices. And so I say that because some of the things, and I'll tell you where we are with our plan and where we are as a college. We knew that, or we found that many people had issues with technology. And with that, so the college went and bought Chromebooks. And those Chromebooks are available for loan. You just have to talk to your instructor and let them know that, hey, I'm having problems with my computer, if you have something to be loaned. And then you can go to the student store based on an appointment to pick one up. The other thing is we have free Wi-Fi at the Bundy campus during the academic year. So when the semester starts, it'll be open from 8 a.m. till 10 p.m. It's basically kind of like a drive-in theater. You're in your car when you're doing this, but you have the Wi-Fi. But it's in order for us to continue to have the social distancing. So, we always worry about people with underlying health conditions. And there are some health conditions that are out there. We talked about it earlier in the presentation, but we are cognizant of the fact that we have to have a dual approach to our teaching. That not only, as we phase into the ability to have people come on campus, we have to have that option for those people that may be vulnerable, so they can still be at home and learn remotely. So the other thing that we want to talk about is providing the greatest degree of contact tracing. We want to maximize the capabilities to contain any incidents that occur, and we want to enable our ability to review and enhance our health care related process. So I think I'm going to go off script now, and so I'm actually going to go to the website itself. There. So as you can see, this is the main SMC website. Right now, you'll see the green up top. We want to change this so it's a little bit more specific to COVID. This was here because we just actually launched this website about a week or so ago. But when you click on here, this now takes you to the COVID-19 updates. And on here, it has the campus status, where fall classes online, campus is closed. And then it has our testing and symptom screening. As you can see here, this is what I do want to show you. It says employee daily symptoms checklist, and then you see visitors health check screening. So if you're coming to campus, the county requires that everybody do a symptoms checklist. So this is where somebody would actually have to log in and say whether or not they had a fever, if they've been exposed to anybody with COVID, and then they go through a bunch of symptoms to make sure that you're not experiencing anything that may be COVID related. I think that's really important. We're also going to have one that's going to be for students. It's not developed yet, but we're looking at different technologies to see which one is the easiest for you. Then we go actually into the roadmap to recovery. So you click here and boom, we're at the roadmap. We try to make it easy by starting out with the phase 2, which is we're in phase 2 up top. And the conditions are limited to, are very limited on coming onto campus. It still says closed. I will say this, the county has allowed us to have in-person instruction for those disciplines that are essential. So our nursing program has essential services. Our respiratory care has essential services. It's not to teach the class, but it's to allow them to have either a practicum or use the lab, because that's something that's required for them to graduate. And I'm happy to report that we graduated 32 nurses over the summer, and we're going to continue to have those classes moving forward. We are also, for the media design students, looking into their ability to use some computers on the CMD campus. And this is because many of them are using the high-end graphic design computers that are about $8,000 to $9,000. And we understand that, that not everybody can afford something like that. So we want to keep within our equity guidelines and, be able to offer this. The county allows us to do so, and the state, because they say media is an essential function. So that's why we're going to go ahead and open that. Any opportunity where we think we can bring people back for those essential services, whether it be technology or anything like that, we want to do, because I think that's really important as we move forward. The other thing that the county allows right now is the fact that we're going to be able to have some faculty members come onto campus, and that's so they can demonstrate or film labs. And I think that's important because it's really hard for them as they teach from their homes, and a lot of times they have to show things that are actually unique to the setting here at the campus. And so we're now able to do so. So I'm just going to go real quick to the phases. So I said we're on phase 2. Under phase 3, this is campus and buildings are still limited, right? And then we still want telework as much as possible for our employees, but some academic programs and services are offered on ground. That could be where we may open up the admissions office or the financial aid office for students to make appointments to come on a campus and to do things. It may be where athletics comes back because we have sports that are done throughout the state, and we want to make sure that they have the ability to compete with the other student athletes that are out there. So that's kind of where we are with phase 3. Now, remember, this is all guided by the county and the situation that's currently happening at that time. Under phase 4, campus buildings and access are modified. Our telecommute is still big because we want it for our high-risk employees, unless they have a workers' accommodation that allows them to do so. And most academic programs and services are on ground. So what that means is there's probably a vaccine out there. It might not be readily available to a lot of people, but we're pretty confident that the numbers are real low and we're able to move forward so that it's safe for everybody. And there's probably going to be lectures and things like that may be modified in a hybrid setting because not all classrooms can fit everybody in social distance. So it may be like you're taking a Zoom class for one day and then you're in classroom the next day. So it's going to be balanced by that. And then the last phase is, vaccines are out there and the numbers are real low and we're back to normal, just like we were pre-COVID. So as you scroll through here, you're going to see many more things in here, like employee guidelines. It's a really interesting read. And then there's the containment response and control plan that Susan talked a little bit about. And then we have a lot of different documents that are really for our employees and our departments that they are required to fill out and really think about before they come back so that we can make sure you're safe, we're safe, and everybody around us in this community are safe. And then we have a glossary of terms. So with that, I think we're going to be open to some questions. So I'm going to stop sharing right now and see if there's any questions that are out there. And Susan, you may have to help me.
There's a lot going on in the chat. I was just trying to keep up with some of the questions. One person asked, when are we going back to campus on ground?
Okay, I think you might have heard it later in the presentation. So really we have to look at several things with what the county says, because the county gives us guidelines. They tell us, and you probably read in the paper, that Orange County may be going back to school, but it's not all schools. They're going to have to petition to come back for elementary schools and the like. We're looking at coming back on ground at least in phases, or I don't want to say baby steps, but for lack of a better term, we're going to take it very slowly as we move back, because we don't want to have to turn around because we have a spike and start all over again. So if anything, it's going to be those classes like labs in the sciences that will probably come back first, or maybe photo or things like that where they have to be out there, maybe theater arts, cosmetology, things like that.
Chief, another question is, do you know when the girls basketball team will get back to practicing?
That's another thing that, like I said, that one is guided by two things. First, that's the CCC 2A, I think, is the governing body for sports. And so they have guidelines. And we have been working with the athletic director as well as the entire staff over there. We actually have protocols in place ready to go that are matching what CCC 2A say. And it looks like for us, there's three categories. There's contact sports, there's non-contact sports, and there's minimal contact sports. I think basketball is in the minimal area, so it's right there in the middle. They're looking at sometime after January if things are good. But like I said, it really depends on the other schools as well. If they start to open up in our area, then we'll probably have the ability to open up too, because the county allow it, so you have competition. So
there were just a few questions that I answered in the chat, but I'll just answer them here too. So someone asked, what if they have class during the food drive and they can't pick up food? So I put in the chat, you could email foodsecurity@smc.edu. That's in the chat. Because there's other food resources that we can connect you to if for some reason you can't make the Wednesday food pantry. And then another question or something that came up was the link I posted was incorrect. We have a new website that is more student-centered. So bear with us because some of the links are still not working. If you just go to smt.edu/health and well-being, and I put that in the chat as well. Then you click on mental health. That's where you can find all of the therapists. Chief, another question. When do students get the link for Zoom for their classes?
So usually that comes from the professors, right? So the professors are going to be sending syllabuses. They're the ones that schedule it in their calendar. When they schedule those classes, they'll go ahead and send those people that are on their roster the Zoom link, because we don't want it just to go out to the whole world. We just want it to that classroom, because you probably heard there's a lot of Zoom bombs and things like that are occurring. We want to take every precaution possible so that you're learning and not having any problems.
Okay, there's quite a few questions in the chat, so I'm just going to read them out. One person asked, what about soccer? I imagine that's the same for basketball.
Yeah, it's the same for basketball, same as basketball.
And then another person said, do you guys know if there's a team to play basketball for the varsity boys basketball?
So I will say this, there's no schools in the Southern California area that are even allowed to move forward. Same with CCC2A has said that as well. So there's no one to compete with until the county starts to open up. Remember, we talk about it where everybody, it's our responsibility to help us to get better. Well, you can do that with you and your friends by wearing the face coverings and monitoring social distancing, washing your hands, things like that, because as the numbers go down, then the county public health will allow us to open certain things up. And that's when those sports will start to open up.
Another question is, when will we know if the winter and spring are going to be online?
So we have a philosophy. We want to be able to let everybody know as quickly as possible. I'm not sure about winter. I think winter's going to be up in the air. And I say that because I'm just looking at the numbers, and by my best guess, I think that there's a possibility if they continue to improve that we may, have some things on ground by spring. But I think we have to look at a couple factors. We have to look at whether or not a vaccine is going to be readily available if they develop one. We have to know if, even if the virus is mutated. So we look at these things. One of the things that I think was very telling, though, and I was really happy to hear that the county is doing better, is 3 or 4 weeks ago, we would have said, no, we're not coming on ground, period. Now we're looking at, there is a possibility. So, we'll monitor it and let you know. As soon as we know, we'll let you know. And if we think that we're getting very close to an ability to do so, we're more than likely to let you know before the news does. Okay.
Another question is, how do students know if their classes are online or in person?
Well, that's outside my area, but I believe that they're told if it's asynchronous or synchronous. I believe all Zoom calls are actually
online or in person.
Oh, in person?
Yeah.
Oh, well, you will be notified by your professor how your classes are going to run. So as we move forward, let's say in a hybrid setting, only certain classes will move forward, and they have to have a plan in place, and it has to get approved by our emergency operations team. And so as we look through that, only those professors will know if it's going to be on ground or if not. And then they will then inform their students. And then it'll also be in the course catalogs. They will mention whether or not it's on ground, hybrid, or whatnot. They may, because of the way things are going, say that it may be online, but then keep posted looking at the website, things like that, because a lot of times after you sign up, the professor may say, well, it may have said online, but we have the ability to go hybrid.
Yeah, and somebody posted something I think really helpful. Like one of the questions was, how do you get in touch with your instructor? It's probably good also to message Pearl, that little bird, when you go on the SMC website. Someone asked if the whole semester is online. If you're online now, chances are you're going to be online at the end of the semester too. I don't think we're bringing any additional classes back. And as Chief mentioned, right now it's respiratory therapy is the only on-ground class.
And nursing. There's one class on nursing.
One class on nursing. When practical film classes will be on campus, so when will film be back online? I mean, on ground.
So right now, since film has to do with a classroom and is part of the teaching, we would have to get the okay from the county saying we can have in-person class. Right now, it's not quite a lab. We are looking at some really innovative ways of coming back. I had a meeting with Theater Arts, in fact, where we're actually talking about maybe starting the class, where they're doing all the rehearsals and things all online. And if we have the ability at the end where they can actually use different angles to show that they're in, close, but they're really not, and do it outdoors so that we have plenty of ventilation and keep it to maybe two people doing the dialogue, that this may work. They actually showed me a rendition on how it would be done. And it's really done through technology where, a person might be 25 feet away, but when you look through the camera lens, they look like they're right across from the other person. So we're looking at these different things to be able to help you guys to come back on board, because we think it's important to have that in-person class. I think everybody here at the college wants to see you here. I know for myself, I have two boys, one, at University of Colorado, Boulder. He wants to be in person because that's how he learns best. And I truly believe some people learn better when we're in class. So we're really working in that direction as much as we can, but we're guided by safety, and safety is the most important thing.
Another question was, someone's taking anatomy next semester. Do you think they'll be back on ground for anatomy?
There may be the possibility of having some labs, but I hate to say it has to do with the county, right? If they say, they're going on phases. So if I was looking at phases for them, they're allowing professors to come on campus for those labs, and they're allowing essential workers. I think the next logical phase for them would be to say students who could come back for labs and practicums that aren't essential. So hopefully that will be the case, but that's kind of how we're looking at things. I will say this, just so you know, once we start getting the go-ahead for certain things, we're also looking at, access for some students who actually have technology problems that they want to be on campus. And we are looking at a location. So once we get the go-ahead, we may be able to have, by reservation, up to 40 students in a particular area to use computers for their studies and stuff. So, but we're not there yet, but once we are, the plan is already written, so we could move forward very quickly.
Chief, did you mention the Bundy parking lot?
I did. It's 8 a.m. till 10 p.m., but it's during the academic calendar. So if there's a holiday, we're not going to be open. We're not going to be open on the weekends. It'll be Monday through Friday. A lot of that has to do with, our staffing to be able to be there and things. And when the college is closed, let's say, a lot of times people are either on a holiday that's granted by the college, or they may be taking vacation during that time period. So we don't have the staff to be able to monitor it.
Another question that came up was, what if someone's class in the spring is on ground, but they live with someone who's high risk? Will they be required to come to campus?
No, that's one of the areas that we will be looking at. So if you're living with somebody high risk, we want to be able to accommodate. So that's why you'll find that most classes will probably be both synchronous and asynchronous, in the sense that they'll be recording these things. So you could be at home, or you may come online at the same time that the class is online if they have certain discussions and stuff like that, and be able to work it that way. It's my understanding, like I've seen some of the colleges and universities where there's not as much as LA County, are looking at things like having half the class come in on Monday and the other half comes on Wednesday, but then half the class still has to go to class. They just have to do it online. So that's probably what's going to happen if you have any of those issues.
And I think that'll help with another question I see, like, will the school accommodate students who either have chronic health conditions or live with someone who have health issues? What happens to them if their class is on ground? So I think, to Chief's point, thinking about options so that there's always an online option for students.
Right. And I think we're going to be moving in that direction until we have something that's similar to how it was pre-COVID, where, COVID may still be out there, but it might be very, very slight, if kind of rare, you know. So, and then, but I think because we've ramped up so much of this distance learning and they have the capabilities of doing so, I can't see why professors wouldn't still allow for that.
Another question is how does this student get their vouchers for I think it's the Santa Monica College Promise Program? I'm going to see if I can find the link and reply to your comment separately.
Right. I do know. Let me say a couple things about some on-ground things that will be happening as well. Not just the bookstore by appointment, but some people may have to come on campus for financial aid to get their checks. Right. So we're going to have a process in place where they'll be informed to go to the Student Services Center, have to go park their car, or they walk straight up to the building. There'll be distance markers, so you're 6 foot away. You'll have certain requirements to do the testing, or the screening beforehand. You'll be asked to wear a face covering, and then if you park in the building, you'll only be able to go to the first floor, and you'll be directed to go straight to those other areas. The other thing that we are allowing for, just so you know, is some programs loan out equipment, like cosmetology is doing coloring kits, and math is giving out calculators to those people in need. So with that being said, what they're doing is loaning these things out, and we have a process in place with different locations around campus where they'll let you know to come during a certain period of time and date to either drive up or walk up to that location. There'll be a marker on the ground where you're staying 6 foot away. You'll talk to each other 6 feet away, and then once they find out what you need, they'll put it on the table. You'll walk up to the table, you'll grab it, and then leave. And then they'll clean the table to make sure everything's clean. So that's kind of how we're looking at things. Susan, do you mind if I share one thing real quick? I just want to share a screen.
There's a couple more questions, just so you know.
Okay. When you come back to campus, you're probably going to see a lot of different things. So this is kind of a mock-up of student services. So you can see there's going to be an enter here. There's actually Polly the parrot up here with a face covering, and then there's also some social distancing signs on the door. We're going to have more than that. So as you come in, there's going to be arrows telling you which direction to walk, because we want to keep that social distancing as much as possible. Elevators will only allow 2 people in an elevator at any time, and there'll be a place for you to stand. We'll also see the exit signs, because we want people to go through the exit signs and not the entrances. As you come up and down the stairs, you will see things like this, where it'll say keep to the right. And these markers are 6 feet apart. So when you see the person get to that step, then you would step off so you could stay 6 feet apart from that person as well. So a lot of these things are happening right now, where we're ordering these things, we're getting the supplies, we're putting them on buildings. There's quite a bit to kind of get done, but we're working on that right now. And this is what student services will look in the future.
So someone had a question about how to access financial aid. You go on the website and you click on admissions and aid. You can join a queue-less line and speak with a financial aid representative online. Question about the bathrooms at Bundy. The students have access to the bathrooms at Bundy for Wi-Fi.
They won't, but at a short distance away, you didn't hear from me, but the short distance away down airport is the airport campus. And at the airport campus, up till 7 o'clock, so it's 7 a.m. to 7 p.m., they're doing COVID testing. And the bathrooms are open at the airport campus, and there is parking there. The reason why the Bundy campus is not open is because custodial services has to be around to clean those bathrooms on a regular basis after use. And right now, we just don't have that capability. But as we start moving forward and allow for it, we'll have that ability. But since if you're coming in car, it's really just a exit out of the the back gate, taking a left, going less than half a mile really, and going to the airport campus where the COVID testing site is. And they actually have a custodial staff person on the whole entire time. So as soon as you walk in and walk out, they'll clean the bathroom real fast for the next person to go in.
Another question is, will there be shuttle services?
Not at this time. Shuttle services will come back as the campus starts to come back. Because we do have protocols for that, though, where the driver will have to wear a mask. There'll have to be certain seats that are designated. We may have a limitation on maximum amount of people that can be on there. The buses are still running around campus. The Santa Monica buses are running, things like that. But the shuttles that are internal to us, we don't have them coming back yet.
And then I think this person's question is probably the question we're all asking ourselves. When's COVID-19 going to end?
I hope soon. I will say this, and I'm sure Susan and a lot of people on the campus feel this way. It feels very weird to be on campus. I come almost every single day I'm here. And I kind of wish that students were around. I mean, because that's kind of why we're here working at the college. And when we don't see anybody, it's kind of like a ghost town, and it's no fun. I know that even my staff has said, they wish you guys were here because at least there's other people to talk to interact with, to do things with. And now it's like a ghost town. So hopefully soon.
I will say that there's a few vaccines that are in their third stage of clinical trials. So hopefully those will pass and we can start distribution. Experts are saying sometime in the spring. And then, of course, we have to give the entire world the vaccination. So I imagine developed countries will be first, but we'll see how it goes. Any other questions? I don't see any more in the chat. We've kept up pretty good, Chief Adams.
Good. I just want to say that, even though you aren't here, I think it's important, and I've said this a couple times, to really take care of yourself. I know that Susan's talked about wellness in a lot of ways. I think it's really important for you to take care of yourself so that when you come back, you'll be mentally, in the game for school. And so Susan has told you about a lot of resources. Take advantage of those resources. I think it's really important. I think we all need to take advantage of some of these resources, because when everything becomes normal again, we want to be ready, and you want to be ready as well. So take advantage of them. That's my last comment.
One question I don't know the answer to is, due to the COVID-19 mutating, will a vaccine kill the mutations as well?
Okay. It is a good question. I mean, so as it mutates, it really depends. It would be very much like a flu shot, right? So every year you get a different flu shot, and it might be based on that mutation or combination thereof. So I don't know the types of vaccinations that are being done, but like with the flu, they're good for like 3 or 4 different versions of the virus, or, the flu virus. I would assume that people are developing vaccinations that are going to take into account the predominant, strains that are out there. And then hopefully that will be, good enough. But then, like anything, things change. You really have to be on top of things. And I know at least the scientists that are out there at the major universities like UCLA, they're working very hard in that arena.
And I am glad that you brought up flu shots, because I failed to mention, and it's so important. Call your doctor and make an appointment, get your flu shot. Student Health is also getting them. They should arrive sometime in September. CS has them as well. Flu shots are very, very important. Actually, for students who are coming to campus, they are going to be required. So it is very important that students get their flu shots, even if you're not on campus. We've had a couple questions about people relocating. Relocate to LA. I imagine this person's taking classes remotely, doesn't live in Los Angeles.
There are people that are taking classes that are not in LA. I know that there are people in different states. They may be home at their parents' house. I know, like at the University of Colorado, my son was given the option to be home, and take specific classes that are all online and stuff. So he was given that option. So I would assume, that there are people out there, because technology allows you to do so, that as long as are cognizant of the time, if you're on the East Coast and you take a 7 a.m. class, it's 10 a.m. or vice versa.
Another person asked a question about whether COVID is impacting PE classes. I think the answer is yes for now. Everything is remote. I know my son took a PE class over the summer. My girlfriend took the PE class together remotely, so they would exercise together and do the Zoom together. Go ahead.
I know the CCC 2A is talking about 18 sports starting in the spring. So we are looking at how are we going to do all of these sports because of the field. So there's a logistic nightmare just, brewing, training area, places to weight lift, places to run, do things. Because if you think about it, spring sports are track, and then you're adding soccer, and then you're adding football. And, they're going to all want the field at the same time. So I think when you were talking about PE classes, I think they'll probably give the sports, I guess, the first choice before we go to a PE class.
Someone asked if this live stream will be replayable. I do believe that this will be posted online so that you could rewatch it.
Right. And it's my understanding, I saw an email that it's not right away, but it will be.
Right. Question about Antivaxxers and folks who don't want to get a COVID-19 vaccine or, in fact, can't get a COVID-19 vaccine. There's a lot of talk about herd immunity. So if you have, a certain percentage of the population vaccinated, you're just by doing that, you're slowing the spread of COVID-19 by protecting, large amounts of people. We think of the flu shot, not everybody gets a flu shot vaccine, right? So it's kind of that public health perspective, try to immunize as many people as you can.
Yeah, I think most of the county orders, we've got a question into the county right now because it actually says required for students, but then for employees, it's optional or strongly suggested. Many of the guidelines that we've seen in the past give an exemption for medical conditions or religious reasons and things like that. There are exemptions, and I would assume that there are exemptions as well.
Yeah. So at this time, we don't have any more questions in the chat, but there were some really, really good questions and a lot of dialogue. And we know this is probably a stressful time for those of you who are trying to figure out when to make certain decisions, especially when it comes to relocating or like you live with someone who has a chronic health condition, so you're worried. Just know that we're watching this situation really closely, and Chief and I are in meetings, feels like 5 days a week together with a larger group of emergency operations folks. So, we want to make the best decisions for our students, and, your feedback is certainly valuable. So we'll bring some of these thoughts and concerns to that committee so people know what you're dealing with.
And just so you know, the Associated Students, they helped as well. They reviewed some of the documents, gave us some suggestions. So, if you have a suggestion or an idea, feel free to talk to the Associated Students, and then they will directly contact us or just email us. We like hearing from people because we're not going to think of everything. That's why we look at other colleges and see what they're doing as well and try to find out what the best practices are. And who knows, you may come up with something that we didn't even think about. And so we encourage it.
And I'm going to put our emails in the chat right now. You all have it. Someone asked about what do you need to bring to get your flu shot. If you're coming to the college, you have to make an appointment with the health center. Don't just show up. They're only there on Tuesdays and Thursdays. So I put the number in the chat. You could email healthcenter@smc.edu, or you could call them, and just bring your photo ID. Any photo ID is fine. Just make sure you have your student ID so we can look you up in the system. And you don't need your student ID to get the flu shot, but someone asked about how do they get their student ID?
So they don't have a student ID right now. So I would call the auxiliary services to find out if they're actually issuing IDs. I don't think they're going to be issuing IDs on ground unless they're needed for certain services. And then what they have done in the past is allowed for it to be done on a case-by-case basis or an appointment basis only.
And someone asked about the health fee, so I'm responding to you in the chat. Your health fee covers free unlimited visits with SMC nurses and also mental health services for free. Let's see. Yeah, so just related to the health fee, so you can connect with a therapist for free throughout the semester. You can also connect with a nurse. We have nurse practitioners. We do immunizations when you're ready for transfer. Flu shots I mentioned.
I think on the flu shots, I was told that if you have insurance, you can go to like the CVS's and they'll take your insurance and go ahead and give you a flu shot there. Then you don't, have to worry. You can go to a local CVS that's close to your house, and you can do it pretty much every day that they're open.
And you can schedule it now because CVS has flu shots. So I think we have just a couple more minutes. So if there's any last minute questions, feel free to post them in the chat because I think this session might automatically end at 2 o'clock.
Okay.
Well, we appreciate everyone's time. Definitely not an easy time to be a college student, I'll say that. So really appreciate you all joining and listening in, and know that we're here for you, and all the SMC faculty and counselors are all here for you remotely, even though we're not in person. And someone just asked, so just to confirm, all classes will be online on Zoom or on Canvas? I think everybody's using Zoom, right?
Yeah, but some are using Canvas as well, I heard. So
okay.
Because they may be tied to a true online class that was designed specifically for online.
Okay, so students should reach out to their professor to find out if their class is going to be Zoom or Canvas, but most likely it's going to be Zoom.
Right.
And then we just have some thank yous. You're welcome. Thank you.
So
wish we could be there in person.
Good. Well, anyway, I do want to just say, thanks a lot for joining us. Share the information with your friends. Let them know that the website's up. I know there's a lot of information there, but it's an easy read, if that makes sense. I mean, because of the drop-down menus and things like that, you can read the things that you really want to know about. I think that's the important part. But you'll see that we've been working pretty hard. I think we're ahead of the game with compared to a lot of other colleges. I've talked to my colleagues; they haven't even written a plan yet. So, I think we're good in that way. So we're going to hope to make things work for you, because our mindset is, if it can happen, we're going to make it happen. But we have to do it safely. So go from there.
So appreciate all your time, and thank you so much for all the positive comments in the chat.
Absolutely. And I know that AS is still having their clubs, so that's another way you can stay in contact with people. So that's something that you should really look at. Socialization is hard right now, and so if you can socialize, I know that a lot of people are doing it through Zoom. You might want to look at that, do your study groups through Zoom, things like that. So that's another way for you guys to stay connected and feel, like you're part of the community. Okay. With that, I think we'll go ahead and end unless we see one more question in the next minute.
Just a lot of thank yous. Where are the clubs? I think if you go on Associated Students' website, there should be a list of them there.
Right, and it's what's called ICC, which is
InterClub Council.
Right, and so that's where you're going to see some of the clubs that are out there. I do know that some clubs are actually talking, or I've heard that they're talking about trying to get the word out that they're still in existence and they're still meeting on Zoom, some of the established ones. So hopefully you'll start seeing some of that.
Oh, and then someone just said clubs will present on Thursday.
Cool. Okay. So I do know that there's another Zoom coming on at 2:00. It looks like the library. So if anybody has questions, because some of this stuff will be online on your distance learning and stuff, and this is how you'll be able to get some information. So I would suggest that since they're starting now, it's probably a good idea to go ahead and do so. So with that, thank you so much. We really appreciate it, and hopefully we'll see you soon. Bye-bye.
Bye, everyone.
You still there?